looks like there's a call here. Let me respond. 432 from Collins in Batavia.
We've got a report of a young female acting irrationally. Looks like possible drug or mental health issues. She's just freaking out right now.
432 10-4.
In any type of call that a police officer responds to, when that officer stops and gets out of that car, the officer has no idea whether or not the person may have mental illness. If the officer lets his guard down, he can be hurt, he can be killed.
When I go out in the community with the Orange Police Department, it's real-time teaching for the officers so that they would know what it takes to work with somebody in a psychiatric emergency.
When they know what the different symptoms might be for the mentally ill, it's much easier for them to switch gears quickly and try to de-escalate as the result of that training.
We are building a stronger community through partnerships in our area.
As a person, a community, a police department, a hospital, a neighbor, it's all of our obligation to help others that are less fortunate than us.
I think the important thing about behavioral health is that it hits everyone. It doesn't discriminate based on economic status or whether you have money or whether you're homeless.
My son Tim was a great young man, and he had a wonderful way about him, smile-wise. Tim was probably around 16 years old. That's the first time we noticed a difference in personality and problems, and he got off on the wrong path.
I don't believe that you become self-destructive just because you like to party. I think you become self-destructive because they have those mental health issues.
The demons that he fought are tough. One night when there was a big party, everybody was doing drugs at that party, and they got in a car, and the next thing anybody knew, he was dead and by himself, single, in an automobile accident.
In the past, mental health has always been something that people are ashamed of. There's a stigma. Our tendency is to sweep it under the rug.
Sometimes their behaviors, because of the illness, are pretty difficult really to understand and to accept.
It's a serious problem, and every one of us have experienced it one way or another through a family member or a friend.
When my son was younger, he was really vibrant, and he always wanted everybody to be real happy. When he was in his early 20s, I started to notice that he was getting confused. He was getting somewhat disoriented. He was losing his ability to have logical conclusions to things. He got to a point that he was fairly gravely disabled.
Many years of my mental health struggles was masked by wanting to look and sound and act like everything was okay in my life. So I would be with family and be, showered and dressed and look fine, but then I would go home and crawl in bed for a couple days.
I remember when I started college, I took a long trip around the United States, and driving on the United States by myself was a very difficult and depressing experience. And that's when I came home and told my family, I've got trouble here. I'm really depressed, and I'm not sure I can continue with my life.
The really sad thing is that no one has known where these patients should go for treatment, particularly when they're the most fragile, when there's an urgent or emergent need.
This is why St. Joe's developed this specialty area off of our main emergency room to kind of address the specialized needs of our psychiatric patients.
My son came into the hospital to see the psychiatrist, and he said to him, "I think you have schizophrenia." It took me a while to believe the diagnosis because you're grieving the loss of a lot of their abilities and the person that you thought they might become.
I was in a major mania at the beginning of 2008, and that was preceding my husband's homecoming from Afghanistan. He stayed for a couple months and wanted to go back. So when he went back, I just kind of fell off a cliff and went into a major depression.
She wasn't herself, and then we knew that this was really serious, and that's when she was hospitalized.
My wife took me to St. Joseph and checked me in, and then I was inpatient there for about 5 weeks. For a while there, I thought I might never come out. But I think as I spent more time, I realized I've got more in my life than just to stay here. With each experience and time, I was getting healthier.
Being able to make a difference is why I personally went into psychiatric nursing. I want to make each encounter the most positive and give them the opportunities to receive the care that they deserve.
Our commitment to every individual person with a focus on their unique potential is what makes us special. The people that come to us are not statistics, they're people, and we care about them.
They started giving me hope, and I was so depressed at that time that it's really the hope that I needed. Now, 8 years later, I actually have been volunteering in the program, and I share my story to the patients and their family members and offer them the hope that I was given in that program.
Many people out in society are hurting, and they need some help. Coming to St. Joseph, they can get help, and I'm blessed to be a part of that.
If St. Joseph's wasn't involved in my son's medical care, I really don't think he would be here today. They saved his life.
St. Joseph Hospital has a long history of treating behavioral health patients mentally ill. We have support groups, we've got partial hospitalization or outpatient treatment programs, and we have inpatient programs if they need a significant inpatient stay. The most important thing for me is building a system where patients are treated with the services they need.
We are going to be totally renovating our 51-year-old unit into an updated unit with 24 high acuity beds, all in semi-private rooms rather than 4-bed wards. We're also going to add a 12-bed chemical dependency detox unit.
We are doing some fabulous work here at St. Joe's, but this takes continued support from our community, from our donors, so that what we're doing today, we can build even a stronger future for tomorrow.
And now, 26 years later, do I miss him? Every day. Every day. Every day. How can you not miss a beautiful, wonderful, smiling face? I guess the part that made things good was when my wife, Mary Ellen, and I decided to try to do something about helping another person. We were the first to start the Behavioral Health Services Endowment at St. Joseph's. It's important because I'm trying to help other people. Just think, if you could help another human being, what more could you do? What more can you do? That's what it's about.